Hey everyone, welcome to another episode of Unbreaking Science. We have a very important episode today where we'll be talking with a panel of people who are very concerned with your well-being. And it shows that they're concerned with your well-being because they're concerned about the state of science. It's a very important discussion that we're going to have today. We have with us Dr. Andrew Wakefield, who is, in my view, one of the most preeminent scientists who's remained objective in spite of attacks, in spite of admissions by people who were involved in the retraction of his study in the Lancet on autism, that his character is disparaged on a daily basis in the news. I have no idea how he continues on with such objectivity and in his gentlemanly ways. Fascinating development, and what brought this episode about is the rest of the panel. Eddie, Alicia, Josh, I'm going to mangle this, and I'm sorry, Wetzko, Yafa Shiraz, and Nettie Ronell, and I apologize for that. Nevertheless, we're going to be talking about their recent paper. It's a qualitative research study entitled Retraction of Scientific Papers, the Case of Vaccine Research. And my little intro that I'll start with begins with the question of the purpose of science, the actual reason why societies invest in something we call a scientific enterprise, because there are different ways of going about the sociology of science. Science as a way of knowing, science as a tool for society to understand what is known, science as an adversarial process necessarily in which different viewpoints will emerge. And how that can be handled. And I want to do this in the context of a bigger discussion of what's wrong with science. And so the actual article will be made available, of course, for everyone to see. But I will bring on the panel, and let me change the view here. So welcome everybody to this fantastic panel of experts. Your concern over the human condition is something that I share, and I want to acknowledge that, and I want to respect you for doing what you've done, all of you, each of you individually. So thank you for what you've done. So the lead author on the article on retraction, how did this all come about? What brought about this qualitative research study?
It's a good question because we spoke about it earlier. Actually, as a criminologist, Josh, Nati, and I are criminologists. It's far away from medical research. I personally never interested in vaccination. I knew nothing about vaccination. I was like most of the people in Israel, and I guess in any other countries, that I vaccinate myself and my child on a regular basis, because I believed in what the system told me. The government told me that it's safe, it's okay, we should vaccinate ourselves and our children and so on. But then I was encountered with a book about the scientific problems in research, in vaccination research, and then I started to know how much I didn't really knew, and I also acknowledged the biases and the manipulation in research in the field of vaccination. And then Nati asked me to join him, and then Josh joined, and also Yafa, who deal a lot in, she's a communication in the field of communication and public health, and she brings us another angles about this situation. And I led this research, but it was fascinating. When I go deeper and deeper, I knew and revealed another things, another manipulation, and so many things that I didn't know about vaccination, and I was intrigued to reveal them. And so we started to explore it, and we continue to explore this field, and we are involved now in more other studies about the suppression of dissent in vaccination and so on.
Yeah, excellent. So in growing up through undergraduate, graduate schools, I went to 3 different graduate schools. I took all the training in science methodology, the peer review process very seriously. Early in my career, I was an associate editor of a journal, and I became the editor-in-chief of a journal. And the process of peer review, to me, is a sacred process. That as we came up, we saw predatory journals that were emerging that would charge an exorbitant fee. They would publish basically anything, and those were outed by the process of some people submitting truly fake fake journals, things like the science of, I don't know, crochet knitting or something like that. It was making outlandish claims and repeated words and things like that would just sail through. So the process of rational discourse in science, to me, always seemed to be a creative process, not a destructive process. Even when we have different viewpoints on things, on matters of scientific inquiry, the process of submitting your ideas to someone else for their review. What do you think about this? Is staid, serious endeavor in science because of the nature of subjectivity. We're all subjective. All of us come with biases and differences in our background knowledge, is how Karl Popper would talk about it. We have differences in our background knowledge. So, and there's differences in methodology and differences in theory and so on. But as I understand your paper, you brought forward invitations. You issued invitations to people who had papers that were retracted.
Yes, we located them through searching in the PubMed engineer, and so we located through them, and we sent them emails and asked them if they will
Sure.
participate.
So Eddie identified 28. So just did a research.
24. That was
PubMed
24.
Under, with the subject like vaccines and retracted, and identified 28 papers. All of the papers on the topic of vaccines that have been retracted that we could identify, or that she was able to identify, were all papers that in one way or another were critical or raised concerns about the safety of vaccines.
And they were scientific inquiries, so they presented new data. So you have right. So let's break it down for the people that don't do science. When we do science, we have a question or hypothesis, and then we do some kind of a study. We take some measurements, and from those measurements, we test the hypothesis, and we present some results from the data. So people often confuse data and results. They're different things. So the results were presented, the results were interpreted. And you're not saying that there's not a role for retraction in science, right? If somebody commits fraud, such as the hydroxychloroquine study that used too high of a dose, made up data, presented to the Lancet, went through peer review, very weak peer review, I must say, it should have been retracted because it was absolute fraud. So there are people that are doing vaccine safety science that are associated with vaccines, and they have an interest in promoting vaccination. And there are people who are doing vaccine safety science that don't have an interest in that. And this is a theme we're going to come up with again and again today, I think, on focusing on the various interests of the people participating in this area of science. So you put out 24 queries, and you had a fairly poor response rate of people that were willing to engage in a survey. It was actually an interview methodology that you used. What were some of the reasons that the people declined to participate?
The main reason, actually, the other didn't answer us, so we don't know. But those who answer us, they replied that they fear for their work, simply like that. I don't want to lose my career. It may be impair my career or something like this.
Well, let's turn to Dr. Wakefield on that moment, please, Dr. Wakefield, because you may have some insights on this. I'm sure you've heard independently over the years from people that have a piece of information or a piece of science or a resource that they should bring forward because it's important to publish the information. that have refused to publish or refused to, or were felt unable and unsafe publishing. Can you talk about this as a general, blight on vaccine science, please?
Yes, yes, James. It's more common than not. It even happened within the context of the Lancet paper. I sat down with my colleagues, John Walker-Smith and Simon Murch, long in advance of the Lancet paper, and told them that I was going to continue with this vaccine safety research and that I was going to act as an expert in litigation on behalf of the children should it ever come to court. And they said, Andy, we as pediatricians cannot be seen to question the safety of MMR vaccine. And that was an astonishing statement. It wasn't scientific, it wasn't medical. It was kind of, what will my colleagues think of me if I get involved in this? It was, what will they say at my club or at my Royal Society? It was absolutely astonishing to me. I mean, so we cannot be seen to question the safety. Surely that's what we're in the business of doing. That was alarming. But I've heard it so many times now. Every time I've spoken to someone on this issue in mainstream medicinal science, they've run away. They've run just as fast as they can. That makes me unusual, naive, and perhaps a little idealistic. But for me, it was a very simple issue of, I either work for public health and vaccine manufacturers, or I work for the patient sitting across the desk from me, whose mother is telling me that this is what happened. And the idea of saying to that mother, after she's articulated this compelling story, which is repeated time and time again, to say, you may well be right, but actually this is not going to be good for my career, so would you take your child, go and find another doctor? That wasn't part of my fabrics. I just didn't make me brave or clever. It just made me, that was where I came from. So, but it was, yes, it is very much the case that even the whistleblowers I've come across, they want to give you the documents and then they want to walk away. I would say to them, do I look like a priest? If you come here to confess to me and seek absolution, you're not going to get that from me. You come with these documents and yourself as a package, because these documents have no value in a court of law without you standing up with them. And many to run away. So it is very much the norm rather than the exception.
So in science, people that are concerned over the quality of science and the progress of science as an endeavor, we have this problem called the recycle bin, which is related to this problem. The recycle bin problem is where scientists who are trying to make their career, who are rewarded by their institutions by finding really interesting results, things that have significant p-values, things that will make it into Science and Nature, findings that will make headlines on ABC News. Butter's good for you, butter's bad for you. The public's head is spinning over the problem of the recycle bin, because for every publication that's published, there's dozens that might not ever get published because it's just not interesting. It's a non-significant p-value. So that's still science that's been conducted. It's just never reported. So as knowledge accumulates in the scientific literature, we come up with a bolus of representation of what science is saying, and it should be representative of the whole thing. And no one has a solution really for how to undo the problems of the perverse incentives that, yes, you've published a paper, but it really didn't go anywhere. You have a low citation index, these kinds of things that institutions create with their perverse incentives. There's so much at stake with the liability that if you say anything negative about vaccines, or at least there has been, I think things are changing now, that this is very much related to that problem.
Not so much.
Let's talk about perceptions. Let's talk about perspectives, because I see a sea change happening right now due to COVID-19. But we'll get to that. My point being, I just wanted, for the people that watch the show all the time, we talk about the recycle bin, we talk about p-hacking, where if you throw away a set of results because you don't like it, right? Because you have an agenda and you're forwarding a specific set of results, that's one thing. But if you have a set of results that you don't like because, well, they're just boring, then that's called the recycle bin. And this is I think the category in which people who have results on vaccine risk throw the results away. They won't bring it forward. And literally with William Thompson, they pulled up a big garbage bin. And when I heard that they pulled a big garbage bin together and they literally put all of their paper notes on the on-time MMR study that ended up being published as DeStefano et al. It made me laugh because in science we talk about that as a recycle bin. So in the normalization of
they're not doing it because the results are uninteresting. They're doing it because the results are inconvenient, right?
But it's still going in the recycle bin, and that's what I'm saying. In that category, in my mind, I have a hierarchy of where things end up in science for a full representation. And it's fascinating because we have criminologists here, we've got sociologists, we've got people, anthropologists who are interested and used to thinking about evidence. You're used to thinking about where things go, and where they come from. And is it representative? And that's an important thing here, is what you're looking at actually representative, not just of reality, but of what scientists are measuring. Is your witness, for instance, actually bringing forward a fair representation of what they saw? This is the same kind of evidence. And so it's more than an analogy. I think it's the nature of being human and trying to figure out reality, right? So we tend to fall into analogies with sports or with, it's like a court of law. And Andy just referenced specifically that you're useless to me as a whistleblower because I want you to end up in a court of law. So as a person with a vested interest in bringing forward the truth, I think Andy's been pushed, and many people have been pushed against the wall sociologically, in the social aspect of science, to the point where the adversarial, the healthy adversarial nature of science is difficult to navigate back there. And that's what I'm doing with Unbreaking Science on this podcast. So there's a couple of words that I want to throw out there in terms of how we can discuss everything that you found that might bring about the sea change that I referenced. First of all, science is not contentious. Science is not combative. It isn't. If somebody's contentious and combative, they're doing something other than science, right? And part of what fascinated me about your paper, and everyone should read this paper, was that you made a clear delineation of the fact that people who attack other people who do science that they don't like the results of in vaccines, happens to be in vaccines. You also mentioned HIV. They actually are trying to, for lack of a better word, pee on their territory. They're saying, this is my area, you don't belong in this area. And they're putting a zone, a boundary around this and saying, no, not only do you not belong in this area, but I'm going to use the following tools to attack you to make sure that you're not allowed in this area. You're not allowed in the club. So I'm going to go after your character with ad hominem attacks. I'm going to go after your expertise, which is a tool. Ad hominem attacks work in the court of law. They really do. Judges pay attention to that kind of thing. But as I learned science, Karl Popper even said it doesn't matter where a hypothesis comes from. You could have an automatic hypothesis generator randomly proposing hypothesis. What will determine the validity of what you find, it specifically, is how you conduct your critical test and how you interpret the evidence in light of the background knowledge. And so we can move all of vaccine safety science. I'm hoping to move it so we consider it adversarial nature of publication, peer review, publication, critiquing somebody else's work in the scientific literature as an alternative to, and the healthy alternative to, this retraction business. So let me ask you more about some of the responses that you got from your participants. Your participants, I remember one quote that said that there's specific individuals who I care not to mention on this podcast because I don't want to amplify their status, right? But they're not worth mentioning in my view because of the damage that they're doing. But specifically, they said that, and this happened to me as well, that, but mine was not retracted, we'll get to that, but a specific individual attacked the papers by contacting the editors or the editorial board and complaining to the editorial board about what they thought was wrong, putting the study under a microscope and arguing minutia. And it's to have a person after it's already passed peer review. It's already been through the first triple jeopardy if they use 3 reviewers, right? It's passed muster. And one person's opinion comes in and they tell the editorial, well, you can't do this. You can't have done that. We're going to actually rewrite history. We're going to overrule the 3 peer reviewers and an editorial board member who weighed in on it, and the editor-in-chief who approved of it, to say, no, this is not allowed. Can you just discuss a little bit about some of those replies that you got?
Let me raise a point here, please, because
Yeah, sure.
what you describe, it's a process we call bullying. There's this one person, individual, who decides for the whole journal, or it might be several individuals, but this is bullying. Someone has power over the other person. And there's another point, and this is the point of victimology. Scientists were victimized, and the people we spoke with, they were victimized by the process. They were a victim of a very bullying attack on them. And to prove it, when the paper was published, they were so happy that we raised their voice. We let them speak through the paper, and it was like personal matter for them to have their voice heard. And this is very typical to victims of any abuse of power, that they want the voice to be heard. They want that the wrongdoing will be confessed, will be said loudly. And I think one of the importance of this paper is to, in a way, to support these scientists, these very brave scientists who knew what Andy told before about these pediatricians. They knew it, and still they decided to keep on with good science, and they risked something. Well, most of them are very much established. Most of them, their career couldn't be affected. They tried to affect their career, but it's beyond. Still, personally, they were very much hurt by it.
Yeah, well, that's when you have somebody that preys upon it. You said the process was unfair to them. It's really an abuse of the process, right? So if I, for instance, all of a sudden decided that retraction was a healthy way to go about cleaning up aspects of the science that I didn't like, then I would go and demand that DeStefano was retracted. I don't think DeStefano should be retracted. I think it should be there for all time, for everyone to see. DeStefano et al. 2004, and there should be 300 papers that cite, in our background knowledge, we know that the MMR result in DeStefano was ignored. That should be repeated through the scientific literature, as this is the nature of the propagation of knowledge in the scientific literature, is people that prey upon the process, these ghouls, as you refer to. I like the phrase ghouling, the prey upon the process.
Bullying, he said bullying.
Bullying, oh, okay, sorry.
Bullying, yes.
All right, well, I like the word ghouling better. How about we do that? We'll create a new word here on Unbreaking Science. They're haunting these journals with the intent of doing harm and scaring people. But it's a predatory behavior that's antisocial, it's anti all of the things. And, you know, I'm the last person to call people names, but again, it's contentious and competitive as opposed to constructive, collaborative. And we need to remind people that science, by its very nature, there's nothing wrong with an adversarial system. Sometimes Grace, for instance, gets extremely defensive of me if I'm criticized, but I'm not a saint, and I've made mistakes, and I learned by my mistakes. I learned from people's constructive criticism, and I've learned somehow to look past it if somebody comes at me with the kinds of personal attacks, the ad hominem attacks. It's literally noise to me. When they say something, I analyze the language that they're using to try to find out if there's something that I've truly missed that I'm accountable for, responsible for. And if I am, then I admit it. And, you know, name calling doesn't really have an effect on me. But these people have mortgages, they have pensions to defend, they have kids in college, they have bills to pay, and to put their life on the line. You're exactly right. They're extraordinarily brave. to continue
Some
to.
of them needed, James, sorry that I interrupt.
Oh, that's okay.
Some of them needed to take a lawyer, a lawyer defense. I hope I'm saying it right, from their own package. So it cost them. It's not that it didn't hurt them financially at all, I must say. And another thing that I really want to emphasize, it's we included the Wakefield case in our literature review. And some of our respondents mentioned his case as a warning sign. Look what happened to Wakefield. We don't want to get to there. They were afraid after the retraction because they knew that the retraction has another more implication. It's not stopped in the retraction. That's the main problem. So we need to look at this phenomenon in an overall view, I think. It's just a part of the suppression of distance. It's already recognized in other field of controversy in science, like you said, in the AIDS, in fluoridation, and so on. But in recent years, I think the vaccination is the most controversial issue.
I agree completely, and thank you for bringing that up. Imagine,
also,
for
sorry,
instance.
I just
No, go ahead.
To finish this idea, they also mentioned another suppression ways that they were underwent, like difficulty in raising funding and defamation on websites and so on. And it's not stopped in the retraction. That's the main problem.
Yeah, the consequences of retraction are a good.
No, it's the retraction.
Them,
It's just one implication. It's not stopped.
Some of them, even the retraction is only the beginning.
That's
Yes.
right. That's right.
Yes.
That's right. So the consequences of retraction are often.
Yeah, because afterwards they can say, "Oh, this researcher, his study was retracted."
Labeled as anti-vax, labeled as dangerous.
Well, let's slow it down for a minute, because there's different ways where paper can be retracted. A healthy process, a healthy road to retraction, involves rational discourse. And I have a really good example that's close to the issue of vaccines. The Stanford researchers that originally found that the orexin receptor there were cross-reactive antibodies to the orexin receptor in the families in Europe who developed narcolepsy after the vaccination for the swine flu vaccination.
H1N1.
For H1N1, exactly. They actually were contacted through the journal by the editors in a paper that was published that said that this is wrong and here's why. They then actually thanked the people who wrote the letter and said, you're exactly right, we admit that it's wrong. And so we hereby retract it. The people who wrote the criticism letter acknowledged the retraction and thereby retracted their letter criticizing them in kind. It was very nice. The Stanford researchers then turned right around and then published their study that they had in the queue, which showed that it wasn't the orexin molecule that their cross-reactive antibodies were adhering to, it was the orexin receptor. And so the vaccine was still found guilty in the court of law for causing narcolepsy. This, to me, seemed to be the way that science should be addressed if there are differences in viewpoints and differences in interpretation. So if there's a methodological problem, that's obviously a bias. Let's dispense with the fraud issue. If you replicate gels and things like that, you make up numbers, fine. But if there's a problem with methodology,
the New England Journal of Medicine and the Lancet studies on the hydroxychloroquine.
Absolutely. Yeah. So the fraud will dispense with, because that clearly should be retracted. But in cases where you have a methodological problem, that's debatable about whether retraction is necessary, because the author should be able to recalculate and republish a corrigendum or an erratum. And it seems to me that these journals have forgotten these mechanisms when it comes to vaccines. They don't allow the same dispensation to the authors. And I think we have to require that, really. We have to, the quality and the reputation of the journal that retracts things on the basis of the predatory actors it takes a hit in my view. Why didn't they just ask for an update?
That's exactly right. And that was a lot of the researchers that we interviewed, that was kind of their reaction. They get kind of, they received this anonymous complaint that was conveyed to them via the editor.
Right.
And generally speaking, felt that the process that followed after that was not a regular process, and it was certainly not fair to them, and that in some cases they responded very clearly, rebutting the criticisms that were made against them. But this was all done behind closed doors, and it's very irregular. The standard way in which this is done, right? And you know this, and all of these people know this because they're established researchers with, collectively hundreds of publications. And the standard way to have this debate is there's an open letter published, and then the authors are given a chance to respond to it.
Right.
No subject, a paper is methodologically perfect, right? There are always weaknesses. There are always things that aren't quite perfect, right? There's no perfect study, so you can always criticize every study. At what point does that criticism rise to the level of something that we can't believe in this at all? This is just malarkey. Right. And anybody listening to this or reading the paper would say, well, look, they only found the only 24 papers they found that were retracted were critical of vaccines or raised safety issues. That must mean that the science is terrible. No, the science isn't terrible, but the way that it's treated and the way that the criticism is treated is is treated with a double standard, essentially.
It absolutely is. So retraction on methodology itself is a dubious practice because the people should be able to update their methodology or retract it themselves and say, yes, you're right, I was wrong, like we just talked about. The editor-in-chief feeling that they need to retract, or the editorial board feeling that they need to retract, means that they're feeling some pressure upon the journal. And with journals being owned in part, in some cases, in whole by pharmaceutical companies, funded through advertisements on their sites. A long time ago, I was going to write a book on biomedical informatics, and I remember visiting the Lancet paper on Vioxx, the one that showed that it was safe. And I remember seeing right next to the conclusion that it was safe an ad for Vioxx. About a month later, everything hit, and it was clear that it was a problem. And I went back to the same website. That ad for Vioxx was taken down. So this is a serious problem. These perverse incentives that bring about this practice. The other thing I wanted to compare this to would be.
May I add something about that?
Yeah.
First of all, there's a lot of criticism, correct criticism, of course, about the popular media, that they are in bed with the industries, and they get a lot of money, a lot of finances from the industries that publish in them, they publish their ads in them. But there's very little discussion about the fact that the exact same thing happens on medical journals. And also the fact that while writers, authors of clinical studies, they have to go forward and declare their conflicts of interests. First of all, what I saw was that not all of the time they do it.
Sure.
And what's even more problematic is the fact that the editors-in-chief or the editors of those journals are not demanded to do that. And at least in one case that was included in our study, one of the problems was that the editor-in-chief of this paper was involved in a conflict of interest. So
That's horrible. Yeah, that's absolutely horrible. Go ahead.
Manufacturer, right? Yes. And
Right,
he didn't declare it. So it was
so
okay.
I always declare all my conflicts of interest. I always do. I've never ever. One time I think I may have done that accidentally, where I forgot to, or something like that, and that should be corrected as well. That's not a big deal.
declaring conflict of interest is great, but it doesn't erase the conflicts of interest. It's as if
Of course
saying, you know,
not.
like I could, you know, if I said, well,
No,
hey,
of
I
course not. I just
applied
meant,
for Merck, but as long as I tell you, it's fine, right? But well, that doesn't.
no, that's not what I meant.
No.
What I meant was that
Fiddly.
coupled with the retraction, alongside the retraction, you also don't mention that the
That's right.
editor-in-chief also does not mention, oops, that he has a conflict of interest.
That's right. And you bring up a fantastic point, because the reason why we report it, it's not, doesn't automatically undo a conflict of interest, but it allows everyone to interpret what you've communicated in light of that conflict of interest. So not reporting it prevents proper or potential interpretation. And not all conflicts of interest are real conflicts of interest either. We have to remember that. So one of the analogies that I came up with in planning this was, imagine if astronomy adopted the vaccine science model of retraction, so that every paper in the past that ever referred to Pluto as a planet should be retracted. And there has, the editors-in-chief, I mean, we should write to these astronomy journals, right, and tell them that they're misleading the public. It's woefully terrible information that's still out there, and the public can't possibly know that there's no longer called a planet because you still have this paper in your journal. And so getting them on that technicality. Andy, what solutions do you have? What ideas do you have where people can possibly a priori protect their papers and their
Well, I really want to refer to something that I think Yaffa said, and that is that the purpose of retraction is just the beginning of a long and painful process, and it's therefore how it should be done is neither here nor there. That's what they want, and they want the retraction to be full and absolute and unambiguous, and to be all over the media with no right to respond, because what it does is several things. It denounces the person who did the science in the first place. It makes them unfundable, unemployable, and it destroys their line of inquiry completely. It does so because it also, as you referred to, terrifies anyone else from getting involved in the science. And the consequences of that, you have to understand the consequences of that. The finding of a bowel disease in children with autism, which was treatable and was a source of serious symptoms in these children that could be ameliorated, was synonymous with vaccine injury, and therefore that too had to be denounced. That had to be rendered fraud. And so the consequence of that is that thousands of children who were suffering were denied clinical care because pediatric gastroenterologists and others refused to touch them because they did not want to be Wakefielded. Okay, so that's one of the consequences. The next consequence, or one of the most insidious consequences, is that if you go to high school biology textbooks, science textbooks, university training, textbooks in medical school, then the story is very prominent. These children are taught that it was fraud.
Yeah.
So ab initio, from the very beginning, they are brainwashed. And here's what's most damaging about that. You've got a multi-choice question, and it says the Lancet paper by Dr. Wakefield was A, good, B, fraud, blah. If you do not give the answer that they want, you will fail the exam. So it becomes self-selecting. Whether you believe it or not, you have to answer that question the way they want you to answer it, or you will fail the exam and you will not. And the World Health Organization does this exactly the same thing for training its administrators of vaccine out in the field. They won't pass the test unless they give the answer they want. So it's far, far more insidious, far more dangerous, far more pervasive than simply the process of retraction. And it is all entirely deliberate, calculated, and intended.
Absolutely, it is. The reason why I'm focusing on the process of retraction is because when it's shown, when you bring, it into the light as a process, right? Then we can see, okay, so the author disagrees with the retraction. The media has tarnished their image. They feel as though they can't defend themselves. But what I'm noticing among some of the people that you no doubt emailed is that they've kind of emerged from that They no longer will accept the boot of the heel of the boot of the oppressive minority, because they are a minority of people that are ghouling these articles and journals, right? And they say, I don't care. It literally matters nothing to me personally. Yeah, it's a pain, but I don't care because I'm going to continue doing what I'm doing. And I'll put myself out there as for instance, in a year and a half, I published 3 articles, all independent, brand new results on accumulation and clearance of aluminum. If they retracted one, it didn't matter because the other ones were not based on the first one. They built on a different body, the cumulative body of knowledge. So part of the solutions, I'm looking for solutions in how to fight back at this systematically, but in a manner that is consistent with actual science, right? Not a street fight. I'm trying to move our considerations away from combative and towards collaborative, and I can't imagine collaborating with a vaccine manufacturer who paid someone who runs a blog website to retract one of my papers. But I can imagine contacting the editorial board or contacting the editor as I submit my papers from the first day in my cover letter saying, you will hear from this person. They will try to retract this if you accept my paper. And therefore, I challenge you to invite them, if this happens, to rational discourse. Please, if they contact you, please offer to publish their considerations and then invite me and my co-authors to respond in kind. Because if there's a flaw, it will come through that process. And then if I have to retract my study, I'll retract my study, right? So you own that. You have to, I think part of the prescription is to place the demand on the journals. And if anyone publishes a vaccine safety science study or any kind of biomedical study that's critical of a drug or anything like that, and the journal starts making noises like, we will decide whether to retract your paper. We have thank you for your reply back, but there's no sign that they're going to publish it. You should retract your paper right at that moment. You should pull it from that journal yourself on the grounds that that is not a real scientific journal, however you want to put it. It's not a legitimate. See, I'm passionate about rational discourse. It's not a legitimate open forum for discourse. And then you can take that study, which you retracted yourself, because it's in the wrong journal, and submit it somewhere else. This is the kind of activity that we can do that stays within the realm of objective science, and it protects all of our common interests in maintaining the good, the bad, and the ugly in the scientific literature. So, if you think about it, there's hardly anything that scientists have ever published that hasn't been proved out over time to be incorrect. Right? So we already have things like we tend to bias our interest towards novelty. We tend to bias our interest towards things that were published in the last 5 years. We tend not to. And one of the references I'd like to share with you is by Ellemers, Fisk, Abele, Koch, and Yzerbitz in PNAS from April of 2020. This is a fantastic example where people were fighting in the literature. They were arguing back and forth, and there was no clear response. And what they decided to do was to meet together as a committee and establish a process by which they could maintain mutual respect for each other. That was the first thing they decided. We're going to respect each other above all costs. We're going to recognize that people have different views. So I don't think retraction on the basis of different interpretation should ever happen. That you try to find 2 people that agree on everything, right? You can't do it. And that's why I don't tend to take things personally. If somebody attacks my science on the basis of I used the wrong scientific symbol in my mathematical equation, that's one thing. If they say that I'm an idiot, if they say that I'm incompatible, whatever, what is the word? If I'm not able to conduct science, if I'm unqualified, then I can see why they're doing it. And I try to take value from that, right? But if this Ellemers PNAS model was brought out, they say things like, you have to be able to argue the other position. We call it steel manning. If you can make the argument of my position based on my assumptions, then that tells me that you can actually understand everything. And so in a retraction effort, in that bid, if someone says, like, if Andy publishes something and I really don't like it, and I'll say, well, Dr. Wakefield did X, Y, and Z, and here's why he's wrong, then Dr. Wakefield can see that first of all, I have to restate what he did, why he did it, and where it came about, and where the conclusions were based. If I can't even say what he did, then I really am not in a position to critique it, right? So you have to steelman it. And they have a creative process called taking your pet theory out for a walk. You know, you have to separate the person from the science. You have to separate the person, my ego. I remember the day that I decided when I was a graduate student doing science that if I'm testing a hypothesis, I'm going to divorce my ego from it permanently. It doesn't matter. I'm not going to become attached to it. I have to remain objective to it for two reasons. One, I might become attached to it and I'll get some kind of a bias and I'll defend it and promote it and I'll interpret the data differently, right? Second, I'm going to be wrong sometime and I don't want to be disappointed. So let's take the good and the bad when you get it right, when you get it wrong, and keep your own scorecard. You know, it's different. They also talk about instead of doing what they should do, I guess, is they should take the papers and they should work them through themselves as if from the perspective that it was their study, and say, okay, and there's a bad way of thinking about this. It's called using someone else's toothbrush. So this PNAS article, which I'll send to all of you and put in the comments, is different. It's a very bad way to think about it, but you should be trying out somebody else's perception, somebody else's perspective. It's very, very healthy in science to do that. And we learn this in elementary debate societies and things like that. But the defense of our common interests is by correcting the process of retraction and demanding that journals that have retracted, they can always go back. They can go back to Brian Hooker and they can say, you know what, Brian, we're going to redo this. We're going to start from scratch. We put it through unfair jeopardy. We see what we did. We're going to restart the process and you're going to be able to publish your response in our journal. There's nothing stopping them to this day from doing any of that. And I'm not a naive optimist. I know that there's billions of dollars at stake in the vaccine industry. There's trillions of dollars at stake in terms of the adult vaccine industry that they're trying to build. However, they're going to lose it all if they don't start doing science. That's my prediction.
James, can I just ask you a question? Because clearly we've got this, if there is a scientific debate, if it's a retraction because of the science by scientists arguing about whether it's the media. In this case, in my case, it was the media. It's entirely different. You're not dealing with a scientist. You're dealing with someone with no medical or scientific qualifications. You're dealing with Rupert Murdoch and News International. Yeah. You're dealing with a process that is completely out with what you're describing here. And, you know, I attempted to resolve it in the court of law where everything was laid out for everyone to judge for themselves. That failed because we were denied jurisdiction in Texas. But how do you apply that when, and I don't know, you may, Yaffa and others, did you find other cases where it was a trial by media and not a trial by the merits of the science?
Well, several of the respondents talked about being, what's the right word here? Basically having their reputations dragged through the mud on blogs and certain websites. I don't think there were any that, you know, got coverage by big media companies or even the newspapers.
No, there were other cases. There was at least one that I remember in which many media platforms took on from the point of the retraction and started smear campaign on this researcher, and then
there were maybe two like this, but not as much as
and then not only the popular media, but also another scientific journal took on, and it went between them. First of all, the popular media, and then again the scientific media. Yeah, we
You know
did.
him, Josh. He's from
Yeah.
here.
So I know exactly what you're talking about.
We have at least two researchers that also underwent defamation and publication in mass media, but not as much as you, of course,
No.
Wakefield. Not that extreme.
One Wakefield is enough.
Yes.
Yeah,
I know exactly what you're talking about.
Very unusual. It's but there are also, like I said, at least two researchers.
Yeah, because they only need
the mass media refer to.
I could relate to exactly what you're talking about, because the modern method that's being used right now, and it's being used on me inexpertly, I might say, I'm having the time of my life, are these so-called fact check websites. They're blogs, they're opinion blogs, they're not peer reviewed. And that's the winning argument. The winning argument is, I really don't care what any PolitiFact or health check or health fact, whatever they call themselves, says about me. In reality, thank you for the press. I'm getting a lot more attention. And when people look me up, they quickly find I'm an objective scientist. I have a fairly impressive resume. Then they find the rest of my studies. So to some extent, we kind of have to become media savvy and use the media against themselves. They have an agenda. They have to say what they have to say. They can't cover what they have. I mean, I would not want to clean up U.S. media. They're biased. They're automatons. They repeat the same thing over and over. But we can use that system in a way that magnifies as opposed to minimize the situation. Every scientist everywhere that's had a paper retracted, if it's wrongfully retracted, still has other publication outlets. They still have the ability to stand up for themselves. In their own home institution, they'll point to the retraction as the excuse for consequences. But in reality, it's the phone call from the pharmaceutical makers that are going to pull their endowed chairs, that are going to cut their funding. It's the phone calls from Anthony Fauci's office saying you're just not going to get any money from NIAID if you continue this nonsense. Knock it off.
He won a prize now in Israel, Fauci. You know.
We heard a lot of stories like that. Just, kind of incredible things that you wouldn't think are even possible. Somebody being told by the dean of, where she'd been for 15 years and doing research and having a great relationship with all of her colleagues, very highly regarded. The dean said, well, actually, you don't have a research position, so you need to stop doing research. Like, you're not allowed to do,
It also depends.
The story you told on your podcast about the dean trading artwork to scuttle a study you were involved in. I mean, I heard that and I was just flabbergasted.
Oh yeah, it's a chapter in a forthcoming book called Pepys, Pictures and PCR. It was a collaboration between two eminent scientists, Mark Pepys in London and Michael Oldstone at the Scripps, to deliberately contaminate samples sent to John O'Leary's laboratory. And the bribe was two nudes that Pepys' mother had drawn. She was quite an accomplished artist that Michael Oldstone had always wanted. And when Pepys suggested to him that he should scupper the study, destroy it, contaminate the samples, Oldstone wrote back and said, this is going to cost you 2 pictures. And at the conclusion of this destructive process, Pepys wrote to him and said, dear Michael, when are you coming to London? Your pictures await you. That was absolutely staggering. This is the arrogance of these people, is that they put it all in emails and allowed it to be discovered in the General Medical Council proceedings. There it was. It was one of the great stories of our time. I'm making a film about it right now.
It's incredible.
They give you so much material to work with.
That's absolutely incredible. So that's the other, way to fight back, of course, is, remember that you're fighting for objectivity in science. You're not just fighting for Andy Wakefield. You're not just fighting for Brian Hooker or James Lyons-Weiler or whoever it is they're going to skewer next.
Yes, I must say in this point, sorry again, because I'm about 10 minutes I have to leave, but
oh, sure.
The main reason, the overall purpose of our research is to make heard the voice of these researchers, because all of them very reliable researchers with many publications in the past. So it's not that you can say they don't know nothing, they know and don't understand in vaccine. We don't understand. We are not doctors. We the criminologists. We didn't examine any aspects of the medical, of the vaccine. But we're talking about honesty and about science. We should be open and fair and balanced and not criticize someone says something that maybe it's inconvenient to the pro-agenda of the vaccine pro-agenda.
Of course, and my message
so this is the main purpose.
It's okay to criticize it.
Yes,
criticism's
okay.
not wrong.
Right.
Critical evaluation, if you publish something, it's open for 8 billion people on the planet to criticize. Right? There are 8 billion people that could potentially read your scientific study.
It's unallowed. See what's happened now in Israel,
Right.
for example. Now in the vaccines of the COVID-19, right. It's crazy what is happened here. It started. The government
you use the right word. It's crazy. Yeah. What we want to do is insist on rational criticism. Rational criticism is a fundamental right for scientists to expect from other scientists. And we need to create an understanding that there's nothing sacred about vaccine safety science. There's nothing sacred about any kind of science. There's just a specific way of going about acting, using your behavior responsibly. Right? There's a behavioral disorder that the ghouls or the bullies or whatever we want to call it, this is a behavioral disorder that any psychologist would say this person is perseverating, they're sticking on one issue. I've never seen these people go after other issues in medicine. They don't go around making sure other journals don't publish the same kinds of papers that have less strong evidence or that actually have methodological flaws. They haven't put on a superhero outfit saying, I'm the defender of truth and reality, and I'm going to clean up all of science. Their bias is exposed by predicting that they're going to come after every single vaccine study, and so they're learning from me, and so now they're going to diversify. They're going to bring in other voices. They're going to change their website, so it's no longer their website. It's got some new fact check name or something, and they're going to be behind the scenes. They're going to try to recruit other people, and this to me is a good thing, because then if it's no longer anonymous, and that's a major win. Right? So every scientist in every initiative that's actually doing objective research, and they're up against the beast, up against the corporatist interest in their results, and it goes against what's allowed, as you so rightfully referred to it, should simply anticipate this in their cover letter and say, I'll be willing to engage, and let me know now if that's not going to happen. Because if it's not going to happen, I don't want you to publish my paper. I don't want you to publish my study. You have control up until they send you the final letter that says, we have all the information we need. We're going to consider it and we'll get back to you. Right then, you've lost control. You can pull your paper right up to the end. So, Natty, you've been quiet.
You should remember that those papers that retracted, they retracted after they've been published. So at the beginning, they were published. They were peer-reviewed.
Of course.
Only after maybe weeks or months, even some papers, even after years, they were retracted.
That's right. So the moment you I have a paper that I'm writing right now on coronavirus death rates. When I submit this to a public health journal, in my cover letter, I'm going to anticipate it'll be attacked, and I would be willing to engage in public discourse, rational discourse. So who's the anthropologist on the team? I want to talk to the anthropologist. I have a question.
We don't have anthropologists.
We don't have one.
Not anthropologists, sociology.
Not today, but it's on the paper.
Criminologists and sociologists.
You have a sociologist.
Yes,
and myself, I define myself also as a victimologist.
Okay.
And Yafa is from communication studies.
Okay, so let's talk about the critiques of. Okay, so let's talk about the critiques of your study, where people have said that you don't conduct science, so you shouldn't be able to comment on this human endeavor. How do you defend what you've done?
I hadn't heard that.
No, me either.
No,
Luckily, we didn't hear such a good.
I know it is a
So far, I
common,
don't know. So far, we didn't hear that.
But when we published the review on the turtle book, then we heard it pretty much. You are not doctors. You can't write about vaccines.
But we never pretend to be. We never pretend.
To the editor-in-chief of the journal, the Israeli JAMA, how come you publish a paper by not medical doctors? It means
So, but it was a book review.
It was only a book review, and still they didn't let it to be published. And we were, myself, I was personally attacked. Not much, because I kept very silent, and it's only a book review. But still, I learned what the business is about. And,
but Nati, the main target wasn't us, not me and you. The main target was, you know, the editor.
The editor-in-chief was the main target.
They wanted to attack him through the attacking us. It's
but
not,
even myself,
we are not here, the main.
My name was published in a TV channel as, and you remember they did some trick to me. They take it immediately. They take it personally, and they attack you personally. And this is, I can't believe this is naive. I'm a criminologist, so I assume it's a field of criminology, and I would say in a more healthy society, it would be under investigation of people who are dealing with crime, because this is crime against humanity. What they did to Andy, now I say it personally, it created a crime against humanity, because it was not only Andy. By itself, what they did to Andy, it was crime. It is criminal. But if you take the consequences of what happened, all the children who suffered afterwards, this is crime against humanity, not less than it. And the victims are those whose paper is retracted, but this is only, you know, the very tiny part of the victims, because most of the victims are those who either receive a very bad treatment or don't receive a good treatment. And because nothing is acknowledged, so they get no treatment at all for something that shouldn't be there in the beginning. And this is criminal.
I agree. I was going to get to the question if the criminality of this, because you are criminologists, some of you are criminologists. From the sociological perspective, I would say that this kind of science is in good hands. That's what I want to say. It's done by the right team. And I hope that in the future you get more responses from people, perhaps as a result of this video, that didn't respond in the first time. And I can advise you, although it's uninvited, that your second study, should you get more responses, would be a validation study. So you've accidentally fallen into, here's the subjective opinions of these people here, and they were separate from this other cohort, and now we've done it twice. So you may be able to replicate your study.
well, that would have to be our third study, because we're right now in the middle of the second part of this, which is it's a study that more generally looks at tactics of suppression of scientists, doctors, and nurses who express doubts, hesitancy, concerns about vaccines, and then experience kind of attempts to suppress them, suppress their views, hurt their reputations, fire them, whatever it is, some kind of pushback. Yeah. And in fact, if I could take your podcast as an opportunity to invite your audience to email us with their experiences of suppression, especially scientists, doctors, and nurses, but really anybody. Have you experienced attempts to retaliate against you if you've expressed opinions, unpopular opinions about vaccines, express hesitancy? What kinds of levels of censorship go on? Do you feel free to talk about these issues at work and that sort of thing? We actually created an email address, vaxsuppression@gmail.com, VAX suppression@gmail.com. So I invite people to email us with their experiences. We'd really appreciate that.
May I ask if you collectively or individually have had any pushback from your own academic institutions? Have you experienced the knock-on effect?
Not myself. I'm lucky to be supported by my team.
Good, good.
Yes,
And
maybe because we are criminologists, we are not in. I think the main problem is those who are doctors or in the medicine world field who are engaging.
well, the tentacles of the pharmaceutical industry are very, very long. So
The Merck School of Criminology is coming to a
Maybe they get
university
to
near
us
you,
eventually. I
I'm
don't
sure.
know, but for now we are okay.
I don't know.
good.
But it's
Well, I'm
also-
glad to hear that.
I will say that-
Wakefield, but you raise a very good point because it's also depends the amount of the I would say that the amount of the impair or the hurt. It's also depends on the tenor of and the position in the work. You know, because I remember one researcher who was relatively young and in the beginning of his career in the academia, he said, if I knew that that this is what happened to me, I wouldn't touch it. It's toxic. It's the vaccination research. So it depends also in the position in
Sure.
work, because those who were in a good position with tenure in their academia, they didn't hurt much. But the other, especially the youngest, they really hurt. So
I
I
think
must also say, Andy, that I was the one who was responsible to recruit these nice fellows here. And I assured myself before they agreed to participate that their position is safe in their institute. I wouldn't let them participate if they were not safe, because I don't want to take this risk on myself. So
You're very noble.
it was an issue. You see, this is still myself being bullied by this, because this is an issue you have to be concerned about, and it shouldn't be. It shouldn't
That is
be.
very, that is a good stand-up thing that you've done. So go ahead.
we didn't hear you.
When
Josh,
Nati
we don't-
invited me to join the project, I said, well, it might be career suicide, but it's important.
Yes, me too. But I remember that Nati told me, are you sure that you want to involve in this because it's a toxic, it's maybe hurt you, but and I said, no, I don't mind, I really believe it. By the way, the same that most of our participants said, we asked them why you are still engaged in this field of vaccination. Many of them, not all of them, but many of them said that they feel moral obligation to do that. It's like maybe Andy here. So this is another paper that we are working on. What motivates this researcher to continue with the job, even though the heavy prices that at least some of them pay.
Yeah, so I can certainly recommend this study of yours in the paper. Not only do you present your results, but the introduction to the background is a stunning indictment of these practices. It's a fantastic reference resource. For instance, how Merck acted took it upon themselves to neutralize scientists who criticized Vioxx. So in terms of people looking for those references and the actual history of what's going on, you tell the story of Dr. Andrew Wakefield, of course, which is, you've done it concisely. The real
By the
issue
way,
here,
most of the people don't really know, and I even didn't know the real story of Wakefield. Like most of the people, before I get engaged and read deeply the sources, like most of the people, I really believe that it was a fraud. Like
I agree. I didn't.
Can
I didn't know.
can I just say something, because I know you've got to leave
Yeah.
on this. For years, this subject has been followed and studied by a friend of mine. He's become a friend of mine. He's a lawyer, an academic lawyer called Clifford Miller, and he has studied this and micro-dissected it for the last 10 years. He's now come up with the definitive forensic analysis of the Lancet case. Every allegation made by Brian Deere and the British Medical Journal. And it's part of a presentation that he's giving, but it is extremely valuable because it goes into it's very granular. It goes into the weeds. It goes into because one of the reasons that people were led to believe what they believed is the allegations were so many, and they were apparently unchallenged because we never got to a court of law, that he was able, Brian Deere and the BMJ were able to get away with it. Now, this extraordinary work by Clifford Miller it's well worth you guys seeing from Israel, because it may give you a large degree of reassurance that every single allegation has been completely refuted. The fraud was completely on the other side. And just an interesting note, because you talked about declaration of conflict of interest and peer review. In the paper, you will know, in Deere's paper in the Lancet, it says, this paper has been externally peer reviewed. That was a complete lie. It was never externally peer reviewed. It was reviewed by Harvey Markovich, who was one of the authors and is an associate editor of the British Medical Journal. It was, and that, if you go to the paper now online, has been removed. What has not been put in there is that the Lancet, the MJ at that time, and still does, is in a business relationship with the major vaccine manufacturers, Merck and GlaxoSmithKline. That was a conflict that was never disclosed. So there's very interesting facts that emerge in this, and I'll give you a link to it because I'm sure you'll enjoy it.
Yes.
Very interesting.
Yeah, we'll make sure that the links are distributed with the podcast and in the comments. And when we push it out, Andy, I'll make sure that I have the right link from you before we do that. So
That's what you said earlier about how can we call ourselves scientists or something like that. I mean, I haven't read that accusation. Maybe I should go online or
I'm good at preempting criticism, if you haven't noticed.
Okay.
You should anticipate this coming.
A lot of
answer it.
natural scientists don't think that what social scientists do counts as science, right? So if that's your predisposition, I don't know what I can do to convince you otherwise. But you know, I can say me, for example, I have a BA from Berkeley. I got a PhD at Princeton. We learned, you know, advanced statistics. We learned about research design. We learned about the fundamentals of science. I have a postdoc I did at Harvard with the Robert Wood Johnson Health Policy Scholars Program. You know, yes, what we did in this paper is a qualitative analysis. It's not hard science, but it provides us with a perspective on the world that we hadn't known about before, right? That it had not been brought to light. So it's you know, we used a valid and widely used research method to shine empirical light on the world. I don't know what isn't scientific about that.
Well, no, that's a good defense of it. In fact, there are many faculty members say that were colleagues of mine who do qualitative research. It's not something that you're making up. It's a valid line of inquiry. How can you capture and represent what a body of subjective understanding is unless you collect it and publish it? So that's subjective understanding is suitable for scientific inquiry. Absolutely. I want to close here. I guess we can all finish at the same time.
So can I ask last question before I'm going?
Sure. We're going to close in a few minutes here. So go ahead.
Oh, okay. One question for Wakefield, because I'm interested in it's personal, from out of my personal interest. You choose to deal with what happened to you with a movie. You are going right. I understand, but that you choose to by making movies like Vax. I saw one of them, and I wonder why. Why did you decided to go to this direction in order to deal with what happened to you and to deliver the message about the safety issues?
Because one, I love movies. Two, I've always been interested. I've been screenwriting for many years. Three, is that we are by nature as human beings storytellers. Before things were written down, before there was another way of communicating, we would gather around the fire and tell stories. An extremely powerful way of communicating complex ideas to a wider population, and that is in the skill of the storyteller, to take something that is extremely complex, that's deliberately made complex, and break it down into a narrative that everybody can understand. And I published 150 papers, so what? I make one movie, Vaxxed. I mean, it's the third movie I've made, but Vaxxed, and it blew the world apart. Largely because Robert De Niro first censored it and then said everybody should watch it. And the power of that film has been extraordinary, and it's changed the landscape of vaccine safety research, because for the first time we had an insider from the CDC saying we've done a terrible thing, we've committed fraud, and they couldn't deal with that. They couldn't deal with the truth. And so that reinforced me in the sincere belief that movies were the way to go. I can't practice medicine anymore. I can't practice science anymore. I cannot stop trying to put right what I perceive as the wrong, the damage that has been done. And so this to me was the most powerful way of doing it.
Yes, I do believe it has a much more effect.
By the way, Brian Hooker's paper was retracted about a week after Vaxxed was released.
Oh, really? I didn't know that.
Right.
Just
So
a coincidence, I'm sure, right?
It's ongoing event.
yeah, it was retracted over the accusation that he used the same statistical analysis that the CDC used on their subgroup analysis. And therefore, my argument is if Hooker should have been retracted, then DeStefano should be retracted on the same grounds. So, it would be very nice to close out here. I think we're all going to close out now with a request to every person who watches the podcast and for all of the panelists to encourage people to write to the Lancet, to invite Andy to issue his own defense in his own words at this time, so they can reverse the retraction of the study, which was a pilot study that noted that gastroenteritis, a unique form, seemed to be apparent in autism. That's been validated. That the parents said there seems to be temporally correlated with vaccination. Correct me when I get this wrong, Andy, but it seems that the parents said that there may be a connection. And 3, the process of retraction was wrong and will never be done that way again. That's what we need to communicate to the Lancet. If you have an email account and you care about science, please contact the Lancet and demand that Andy have his say. And I want to thank all my panelists today on Unbreaking Science. Send me anything that you want to be distributed with this, any resources and links and so on. Andy, I will definitely get that from you. This has been a fantastic exchange of ideas, and I'll be sending you guys that PNAS work. We can bring science back to biomedicine in spite of the perverse incentives and the evils of billions of dollars coloring people's views on their control of humanity. Dr. James Lyons-Weiler signing out. Thank you all.